Okay, well, thank you very much. I am really grateful for the opportunity to come along today. I'll talk a little bit about why, but just from a personal point of view, this is important to me. I will be reading off a bit of a script, so I don't go off off script and start rambling. But I have been working through the words that I wanted to say today. So a lot of this really does come from the heart for me. So let me just get going. So this event is part of a series of collaborative events to mark the 16 days of activism to end gender-based violence, as you're all aware. I know this has run in previous years, and I've asked myself, what could I do to contribute in a meaningful and practical way. Speaking at this today is at least something that I can get involved in to kind of be involved in those 16 days in a practical way. But I don't see this as the only thing I should ever do around this. I don't think this will be the last year this will happen, sadly. So I'm looking for ways to get involved in future years. Sadly for me, some of my earliest memories relate to the threat and reality of violence against women and girls, mainly through what I saw when I was growing up, and it's been a recurring theme throughout my life. So personally, ending gender violence is a cause that is hugely important to me. I think it's important to increasing number of people, but it's just going to be something that's going to be close to my heart going forward. And I do take it into my work, and I'll tell you a little bit about that. So, as well as my own views, it's important that I make clear the Scottish Government considers violence against women and girls to be a violation of human rights. We are committed to tackling this violence through decisive action across all key policy areas in government. That range of key policy areas is wide, and I think it's a lot wider than many people would think. From again, going back to personal experience at work, I was involved in some work with a range of colleagues from the women's movement in particular on the gender pay gap, and we talked about stuff we had talked about endlessly in the time I was in that area. I was there for about 10 years, but we talked about why girls and women make career choices based on gender stereotypes. And never before had the threat and reality of gender-based violence come to the fore on that discussion, but it certainly did during that work. It really changed my views on how people like myself in government have a responsibility to look at these particular aspects of women and girls' lives in terms of trying to understand why decisions like those around subject choices are getting made, career choices are getting made. It just changed the way I look at it. And so it made me think that, violence against women and girls is something that is something that cuts right across many, many policy areas. And certainly when I came to mental health, we'll talk about it in a little bit more detail. It's something that I was kind of coming fresh off that work, looking at the stats around around women and girls' mental health. You could see that there were things going on there that weren't really getting talked about. And I very much felt that violence against women and girls was a factor in all of that. So I think one of my roles in government is to get colleagues to think about this issue in ways that they haven't before, and think about what they need to do differently in response. It's fitting that the theme this year is Unite. It's tackling this role. This is the role of every individual, every community, and every institution in Scotland. It has to be a collective effort across systems and services, as well in our everyday lives. So I think this is something that I think about at work, something I think about a lot outside of work, about anything I can or should do. I was involved in the Improvement Services original research project, and that followed on from our COVID transition and recovery plan, as some of you might know. That was specifically around mental health. And we made an active decision at that time to include the mental health impacts of gender-based violence on women and girls' health as something that we would prioritise as we took that forward. So this work links directly back to that experience previously that I spoke about, where we took an active decision to include this in. I'm glad to be involved again in having these important conversations, and I definitely will stay involved. We don't want to lose momentum. The needs of women and girls affected by violence must remain a key part of any future policy development, and I will continue to prioritise that in mental health for as long as I'm in this job. We know that everything that has happened since the start of the pandemic has had a hugely negative impact on the mental health of many groups within our society. And our understanding of that impact, I think, is still evolving, and it will do for a number of years. I think the cost of living crisis is exacerbating that. And I don't think I need to tell anybody in this group what that will be doing to the women and girls that we are talking about today. So, you know, the mental health impacts of pandemic cost of living crisis are wide ranging and long reaching. And so it's something that we will be focused on as we move forward. I understand officials have already given you an overview of some key policy developments in mental health, and you've offered your valuable expertise today in terms of the opportunities or areas where we can make improvements, address the gaps, and ultimately just do better. Your input will be particularly valuable for my colleagues, including myself, who are developing the refreshed mental health strategy and delivery plan. At present, there are a number of really promising initiatives in the mental health space that we are funding, particularly through the Community Wellbeing Fund. So, for example, Edinburgh Women's Aid have received funding to develop a specialist role in mental health. I think those sort of initiatives are important in their own right, but I think they're also really important in terms of the learning that we can get from them as we move forward to help us understand what works well across all our systems and for all our service users. We know the third sector plays an invaluable role in supporting women and children, and that many organisations and partners are receiving funding from the National Delivering Equally Safe Fund. Some of you might be aware that the fund manager, Inspiring Scotland, published a sub-report this morning focused on mental health that clearly highlights that many women and children are looking for more in terms of mental health support. That sub-report, together with the research produced last year by the Improvement Service, paints a clear and unequivocal picture about the barriers women face when seeking support and accessing services, and that will form an important part of future policy, including flagship policies like Equally Safe and our refreshed mental health and wellbeing strategy. I would hope that would go wider just in mental health in terms of where that might make an impact, but it certainly will be pretty important element of the work that we'll be doing on our strategy. So I'd like to thank you all for your time today and helping us continue this vital conversation. It doesn't end today, I hope. I'd like to extend my thanks to the Improvement Service, to COSLA and to Public Health Scotland for their joint efforts in making this event a reality. Really grateful for that. I understand that there are some survivors who also attended today and shared your testimony. I think it must be a really hard thing for anyone to do, but I'm sure it will have struck a chord with many people attending. So I'd like to thank you and commend you for your bravery, and absolutely commit to you that your stories will be at the heart of our efforts to do better going forward. I look forward to continuing to work together on this hugely important agenda, and I hope I've just given you a bit of a flavour that for me this is something that I have been prioritising and will continue to prioritise. We'll continue to learn from talking to people like yourselves. I certainly would not come along to this saying I know what the answers are, but I certainly am committed to keep learning and trying to take steps within the work I do to make things better. And I know that my colleagues across the Mental Health Directorate are in exactly the same position. So thank you all. Your time with us is really valuable to us, and I hope it will make a significant difference going forward.